Good morning. We are so glad to have you join us this morning for the town hall with myself, Representative Liz Boldon, and Representative Tina Liebling. We will get started here. Have folks joined on Zoom. We are also streaming on our Facebook pages, and so happy to have you join. Just a reminder, we will be taking questions. We have some questions that were sent in previous, so we'll start with those. But if you have questions as we continue, feel free to put those in the chat. Either here in Zoom or on Facebook. And a reminder for those on Zoom joining us here to please keep yourselves muted so we cut down on that background noise. And we're so happy to have you join this morning. I am Liz Boldon. I represent District 25B, which is Northern Rochester. If you are not familiar with me, welcome. My background is in healthcare. I'm a nurse. I work in education and leadership. And so I am now in my first term in the Minnesota House. We are in week 9 of a 19-week session, I believe. That's where we're at. So moving right along, it sort of seems crazy that we are that far along. I have been saying the days are long, but the weeks are short. And so things are in full swing. It is very busy. We are working on lots of really good legislation, and I'm excited. I hope we get to talk about a bit of that today. And we are working towards building a budget is sort of a hot topic right now, and really the bulk of our work. And so that is, we will, I imagine, talk about that as well. And so, my focus is making sure that we are taking care of Minnesotans, that all Minnesotans have what they need to be safe and cared for and thrive. And so keeping that sort of the focus of the budget and the work that we're doing. And with that, I think I look forward to questions, and it's really important to me to connect with folks across the district. And so given that we are all sort of in this virtual world right now, and in-person connections aren't safe for the most part right now, given where we're at with the pandemic. This is a really good way to hear from you and engage with you. And so grateful for you to be here this morning or watching later. And so look forward to the discussion and the questions. And with that, I will pass to Representative Tina Liebling.
Well, thank you, Representative Boldon, and thanks to everybody for joining. I'm really excited to be here with Representative Boldon, and she kind of laid out where we're at in the session. And, it's been a very crazy time for all of us with the pandemic. And we hope very much that we're seeing the beginning of the end, although unfortunately, we had some kind of bad news yesterday about the variant, the B117 variant that has been there's been an outbreak of that in Carver County, and that is the variant from England that was, caused so much havoc there. So we're not out of the woods yet, but it has impacted, of course, we're all virtual, which is one of the big noticeable impacts of the pandemic on the legislature. It has really impacted the way we do our work. And we're just really happy to take your questions today. I'll stop talking and we'll get to your questions. I do just want to say that, of course, we can't take everybody's questions in this brief time, but we do invite you. And at the end, I know we'll invite you again to email us with additional questions, and happy to answer things that we may not have all the answers to right here today during this hour. So with that, I'm going to turn it over to our moderator, DJ Danielson, and thank him very much for helping to set this up and for being our moderator today. And he has some questions that he's going to start with.
Hey, good morning, everyone. Glad to be participating in this with you all here today. Just a reminder, we did get some questions in ahead of time, and if you'd like to ask a question, feel free to drop it in the chat, either on Facebook or on Zoom, and we will get to those as time allows. Question here on criminal justice reform, wondering whether there'll be any advances made this session in that area, particularly with respect to juveniles. The constituent is especially disturbed by the fact that juveniles can face a requirement for a lifetime registry in the predatory offender database, even though there's scientific evidence that there's only a 7% probability that juvenile sex offenders will recidivate after successfully completing treatment. So thoughts there, either broadly on criminal justice reform or specifically to what that question was about there.
So would you like me to, shall I take that one, Representative Boldon? I could start.
You can start, go ahead, and I can follow up.
All right, so I think neither of us are serving directly on the Public Safety Committee where these bills would go. So I don't think I can be very specific about specific bills, but I'm a former criminal defense lawyer, and these kinds of issues have always been super important to me because I have seen the injustices in our system firsthand. And I am happy to report that there is a lot of interest in criminal justice reform, particularly driven by the very, very well understood and documented inequities, racial inequities in our system. And this is a key area for starting to address some of these inequities. So broadly across the legislature in the House, which is the part I would know about, there is a lot of interest in criminal justice reform. And even among Republicans, I have to say, I think partly driven by the Koch brothers organization, Americans for Prosperity, because they have this as one of their issues, and it has brought along some other Republicans. So I'm really pretty hopeful that we'll be able to make some strides in this area. There are a lot of work being done both in the legislature and even in the agencies around how to really help people be rehabilitated and get on their way, and how to stop criminalizing stuff that shouldn't be criminalized, like poverty, and really changing the way we think about criminal justice.
Yeah, I would echo that. I also don't sit on the committees that would directly, have the first run at that legislation. But I also sense that there is a commitment and a desire, certainly across the House, to work on legislation within the criminal legal system. And just as Representative Liebling said, to make it more equitable, given that we know there are baked in, racial inequities within that system. And so I do know there is good work happening. I can't say specifically if to the specific question that the individual asked about the juveniles, which is a great question. I do know one of my fellow first termers, Cedric Frazier, who does sit on those relevant committees, is very passionate about this work and is doing really good work there too. So we'll stay tuned. And if there's a desire for a specific answer about that specific question, as Representative Liebling said, feel free to email us, or we can certainly take that and follow up to get a specific answer.
Next question here. We got someone who wants to thank you both for continuing to be gun sense champions, and wondering if you support the red flag and comprehensive background check bills to end gun violence.
I can start with that one because that is a very easy answer for me. The answer is yes. I am very passionate about this topic. I think, gun violence is absolutely an issue we need to take action on. From both my personal life as a mom, I have 3 kids that I worry about their safety, and my background as a nurse. I have definitely cared for many patients who have been victims of gun violence, and this is something that we, there are things we can do about this. We are not helpless in this situation, and so common sense reforms that the vast majority of Minnesotans support, like the universal background checks and the emergency risk protection orders, are things I absolutely am in support of, and things I think we need to do sooner rather than later.
Yeah, absolutely. And these things, I sort of view these 2 bills as the low-hanging fruit. This should be easy. This should be nonpartisan. And in many, sometimes it is, but the Minnesota Senate, which is Republican controlled, Republican majority, still refuses to take these bills up. So I'm not sure if we'll actually see them on the floor of the Minnesota House again this term, as we did in the last term, because of but there is work going on. There are bills out there, and I remain as committed to those as ever. And we'll just keep working to make that happen. But the Minnesota Senate has really blocked that effort, what should be really easy, common sense couple of bills.
Okay, next question here. There was some movement on this in the nation's capital this week, but the question is wondering about why does it seem that people are wary of the $15 minimum wage? And do you think we should wait until the pandemic calms down?
Why are they wary of it? Well, it's hard for me to get inside their brains. The minimum wage has been very well demonstrated to be a really good policy. Raising the minimum wage raises all wages and is good for our economy. It is good for our economy. And usually the rhetoric is that this is going to hurt small businesses and et cetera, et cetera, et cetera. But in fact, the people who are hurting right now during the pandemic, yes, a lot of small businesses are hurting, but the workers who work in those small businesses are really hurting. And there are ways to do this. I do not think we should wait. I think we should continue on this path. We in Minnesota have been leaders in this. And we already have in our large cities a path toward $15 an hour. And this has not hurt our economy overall. So it would help all of us if Congress would pass this nationwide. That would help us, and it would get rid of some of the rhetoric, frankly, because sometimes we hear, well, we don't want to be an outlier because businesses will leave, which we have never found that to be the case. But it is rhetoric that would have to go away if we could pass this nationally.
I agree. I'm not sure that I can speak to why folks are hesitant about it necessarily, but agree that it's something, again, it sort of seems like something that should be low hanging fruit. The idea that we should have people working for what amount to poverty wages is just, it's not right morally, and it doesn't make economic sense either. So it's absolutely, to me, it's something that makes total sense. And I just would add that if we follow inflation, it wouldn't even be a $15 an hour minimum wage we would be talking about. It would be more about $22 an hour. And so, I think, $15 an hour is something that should absolutely happen and would benefit everyone, especially the workers who most need it, especially right now. So in terms of should we wait till the pandemic is over? We don't know when that's going to be, and we likely will talk more about that specifically, but we don't, there's no end date. There's no timeline that we know of when it will end. And so, and this is the time when folks who are making, in those minimum wage jobs need help the most and have been struggling the most over the last year, certainly. And so in my view, it is something that should definitely happen.
And, Representative Boldon, you made me think of this too, that it would be so much better if we just raise the minimum wage gradually over time, all the time, and not let it languish for so many years and then try to boost it a lot, because that's where it becomes difficult for businesses to handle the big change. That shouldn't happen. It should just be a gradual going up all the time. And like you say, it would be quite a bit higher than 15 if that had happened.
Yeah.
Next question here is about ranked choice voting. Wondering your thoughts on House File 89, which allows municipalities that choose to explore its use. Constituent noting that at its core, ranked choice voting's only mandate is that elected leaders demonstrate that they have the support of a majority of the voters, and that's it, with taking away the spoiler effect. So thoughts on House File 89, municipal use of ranked choice voting?
Well, I can start if that's okay. I am a supporter of ranked choice voting, and I actually sit on the local government division, and we will be the committee to hear this bill when it comes up and is heard. And so I look forward to that hearing. As I said, I support ranked choice voting and have for some time. I think it strengthens our democracy, which I think, especially right now, is really important given, sort of the environment that we're in and what's happening in our country and in our state. And as was said, it does, it causes candidates to want to earn the support of a broad, the most broad support or the folks who win. And so it cuts down on that sort of negative campaigning. It puts the power of the power into the hands of individuals and the voters, and that's where it should be. It cuts down on those spoiler candidates, which is something that we have seen in our state recently and historically. And so I am supportive. I think it's a right step for strengthening our democracy, and look forward to the hearing coming up.
So I think that the question was kind of more directed at me, and Representative Boldon stated very well the case for ranked choice voting, which I agree with everything she said. The particular bill, first of all, I don't sit on that committee, so I won't hear the particulars of the bill until later on. But I was glad that the question was named the specific bill so that I could look it up ahead of time. And in fact, what the bill does is not just allow local units of government to do ranked choice voting, which is something I very much want to see. I would love to see Rochester do this for local elections. I think that would be a great thing to do, and I'm really hoping for that day. But the bill itself says that ranked choice voting must be used for federal offices, state constitutional offices, and the legislature. So there's more in the actual bill. And the reason I haven't jumped on board this particular bill is I really would like to see this roll out first in municipal elections, because I do worry about voter confusion. And at the point we're at right now with elections, and there are many things we need to do to strengthen voter participation. And we have other bills that are moving to try to really strengthen. Everyone should be encouraged and allowed to vote. That's just a fundamental freedom and right and responsibility in our country. But I do worry that when we inject a lot of new things kind of without really laying the groundwork, that we may confuse voters and actually have unintended effects. So that's kind of my little bit of concern about this. And we'll see when it goes through the process how all these things get worked out. So I'm certainly not saying no to the bill, but neither am I jumping on board this particular piece of legislation just yet.
Got a couple questions here regarding paid family and medical leave, asking if you'll support the kind of paid family and medical leave program where everyone chips in and everyone can benefit when they need to take care of a loved one. The constituent notes, they're wondering about House File 1200 and not Senator Nelson's tax credit bill, Senate File 1780.
So paid family leave is a fantastic policy. And the way this has been put together in 1200. I haven't heard that yet in my committee this year, but we did have extensive hearings on it the last couple of years. I believe this is a policy that would do more for the health of Minnesotans than just about anything else across the board. Giving people the ability to take time off when they need it, to deal with certain things, caring for a loved one, caring for your own health beyond just the immediate sick leave, if you even have sick leave, which not everybody has. So this is a really important policy. I like very much the way it's been structured. It helps, many of us have this in our jobs, but other people don't. And this is something that everyone really needs. So, I'm not really familiar with Senator Nelson's tax credit bill, but, tax credits are just, there's a use for them at times, but we really over rely on tax credits for a lot of things. This doesn't make sense the way this is structured, because it's something that we are all used to, that businesses are used to, and builds up a pool of funds, very much like unemployment compensation, where employers pay in a little bit. So I'm really hoping the bill can go forward this year. It would be one of the biggest things, as I said, that we could do for Minnesotans.
I would agree. I think this is huge and something we need to get done. I am very supportive and have signed on as a co-author to House File 1200. I sit on the Early Childhood Committee, and we did hear this bill a week or two ago. And Representative Richardson did a fantastic job, and just hearing the stories of the testifiers in committee of how this would affect them, and the stories of people who moms who have a baby and go back to work in 2 weeks is just really it's not okay. And so folks should not have to choose between their job and taking care of themselves or a loved one. And so this would impact so many people's lives. It is so important and something we need to get done. And it is an equity issue, in my view, as Representative Liebling talked about. There are folks who have this right now, and that's great. But there are also folks who do not have this right now, and it is something we should make available to all Minnesotans. So definitely in support.
Another question here on tax credit, but very different tax credit. Do you support the Minnesota historic tax credit legislation?
So go ahead, Representative Boldon.
I was just gonna, I'll start and then pass off to you. So I, again, don't sit on the tax committee. And so if this, don't have direct and lengthy and deep knowledge about this. So just in general terms, I'm definitely supportive of historic, sites and properties and landmarks, and it makes sense to me to keep those up. But I would have to look into more specifics of that specific tax policy, as that's not directly related to the committees I sit on.
Yeah, so, and that's fair. I mean, I used to sit on the tax committee. It was some time ago now. I've probably forgotten more than I remember about some of the really ins and outs of tax policy, but I do support this particular tax credit because, tax credits are often used to influence behavior, incentivize certain things. And oftentimes they don't actually do what they're designed to do. And then they just stay on the books forever. Ironically, this one is going to sunset, and this is one that actually does do what it's supposed to do. So those of you who like historic preservation and want to see old buildings stick around and how they really enrich our communities, this does actually help people develop and retain those buildings. So I think it's a pretty important policy, and I do support it fully.
Question here on childcare. Greater Minnesota is experiencing a huge childcare gap. What's being done to create more slots for families?
Well, I will jump in here first if that's okay. This is an issue that I am very passionate about and doing a fair bit of work on. My serving on the Early Childhood Committee has been just fantastic. That has been a great experience, and I have learned so much, and I'm really happy to sort of dig into some of this work. I am carrying a couple of bills that are aimed at this. One would create a task force. And so first, let me just say that recognizing that this is a huge issue across Minnesota. There just was a recent article that came out sort of highlighting the childcare deserts we have. Over the pandemic, we have had many women have to come out of the workforce because they do not have can't have access to childcare. And so this is a huge issue. It's a issue for families. It's an economic issue, and one that we absolutely have to tackle. Our childcare, early childhood system as it stands right now is not working. It's not sustainable. And so we absolutely need to do something about that. And so one of the bills I'm carrying would create a task force with 3 goals. One, making childcare affordable for all families. So making it so no family would pay more than 7% of their income towards childcare and early childhood. And that would make a huge difference, as right now we know that many families are paying 30, 40, sometimes 50% of their income going towards childcare. It's equivalent to a second mortgage oftentimes or more. So one of the goals would be affordability. No family pays more than 7% of their income. 2 is accessibility, that every child across Minnesota has access to quality, affordable childcare, regardless of race, place, family income. It's accessible to all. And then the third goal of the task force would be to ensure that the providers of this care, critically important care and education to our littlest Minnesotans, that those folks, those professionals doing this critically important work are paid a livable wage, because that's the other side of this coin. Right now, our system is incredibly expensive, and the professionals who are doing this work are not paid a living wage. And so that's a balance we need to strike. And so my bill would create a task force with a specific timeline and some goals set out, with the membership of that task force being spelled out to include folks across the continuum of early childhood and early learning and early care, making sure that we have some diversity within that task force, as well as folks from greater Minnesota and urban, suburban areas, really to bring in the folks who are doing this work and closest to the work to figure out how do we make this system one that works for families and care providers. And so happy to continue to have discussions with folks about that and move that through the process. It was heard in early childhood earlier this week, I believe. My days are running together. And then the second bill I have related to childcare is related to our CCAP program, which is the program that the public program folks used for paying for childcare, and so increasing the rates with that program. And so currently we are not sort of at the national standard or national kind of gold standard benchmark goal of the rates that are paid to childcare providers for childcare. And so we absolutely have room to increase that, and which would allow greater options for people on that program, on that public program, greater options for them to choose childcare providers, and would increase the compensation for the folks, again, doing that critically important work. So I am really excited about this. I think there are absolutely things we can do in this arena, and I am excited to be taking that on, because it's critically important. Talking to folks across the districts, stories of what this means to them and what this means in their life and for their families it's critically important. And we know that investing in our littlest Minnesotans in that critically important time is, the return on that investment pays off for decades and honestly generations to come. So again, this is another one of those things where not only does it just make sense morally, it is the right thing to do, it's also the economically sound thing to do. So happy to do that work.
Well, I'm just so delighted that we have Representative Boldon focused on these issues, and just echo everything she said. It's really obvious that she has a little bit of passion for this. And I would just add that I'm so glad she's taking a holistic look at this, because historically we have only focused on kids from school age up. And all the research shows that that's where all the investment goes. And yet a lot of the brain function is already there, a lot of the brain development. We really need to focus earlier, and yet that's been viewed as a private issue historically. So we really need to take a different look at this. And I'm just so happy to hear that Representative Boldon is, and of course I'm not hearing for the first time, but I'm really happy with her passion and involvement in this issue.
Question here on healthcare. What's the status of House File 11, the public option? Also, will House File 1774, the Minnesota Health Plan Bill, get a hearing?
So as many of you may know, I chair the Health, Finance, and Policy Committee this year, this term. House File 11 is what used to be called the Minnesota Care Buy-in Bill. And it tries to put a public option out there for insurance for people who have to buy their own insurance on the market, or for people who have small businesses that try to provide this to their employees. So it's really, critically important, because the people in those situations have enormous costs, including enormous out-of-pocket costs, almost amounting to not having insurance at all, even though it costs them many, many thousands of dollars. So this is a super important bill. It's a little bit delayed because we're trying to get fiscal notes, and this session has been, everybody is working from home and remotely, and every single thing throughout state government is working slower than usual. So we're having a hard time getting fiscal estimates, but we absolutely intend to take up the bill again and move it forward. Now, whether it will go anywhere in the Senate is another question, but we hope to have this for negotiation. So all of you should, I hope, talk to your senators about this bill, because this is really a really important piece of what we need to do for Minnesotans who find themselves in that extremely difficult situation. And we still do have people who are just plain uninsured because they don't qualify for programs and they cannot afford insurance. And that should not be the situation anywhere, and yet even in our own community. The second piece, remind me, DJ, what was the second bill?
That was the Minnesota Health Plan Bill.
Oh, the Minnesota Health Plan, yeah. So, I've been a big supporter of the Minnesota Health Plan forever, but this session, we are so squeezed for time that the Minnesota Health Plan as such, is not sadly going to be able to get a hearing this session, possibly next session, because we just, it doesn't have a path forward right now. And we are so squeezed for time trying to get things heard that need to be heard, that we actually believe we can use in negotiations at the end of the session, or actually, that we know that the Senate will agree with. So, I remain a big supporter of that. And believe me, I bring that issue up like all the time in committee when we hear these bills that are intended to fix the market and all that. And yeah, we have to tweak and try to fix what we've got, but all the while recognizing that we're just fixing a broken system that fundamentally can't be fixed. And I see more evidence of that every single day, especially during the pandemic. So I still remain a big supporter of making a fundamental change in the way we do healthcare in this state and in this country.
I would agree with that, and having the opportunity to serve on the Health Policy and Finance Committee with Chair Liebling, so appreciate her leadership in this space. And hearing in that committee and others, just, again, the stories from Minnesotans and folks of, what this means to them. I would echo I'm hesitant to say the brokenness of the system, because systems work as they are designed to do so. And so, if you were to build a system that was centered around people and patients and families and care for people, this is not the system that you would build. And so we absolutely need fundamental change to put people at the center and ensure that people can get the care that they need. And so broadly speaking, in terms of values, healthcare, again, is just everybody deserves access to quality, affordable healthcare. It's really heartbreaking to hear the stories from folks across the states and across the district who are either uninsured or even underinsured. As was said, some people have insurance on paper, but what it amounts to is that they actually don't. And so, as Chair Liebling said, some of these things that don't have a path in the Senate right now. And so we will keep at it and keep moving things forward of things that we can accomplish and things we can do, knowing that there is greater and bigger work ahead, because that's the work we need to do to be sure that people are cared for.
Question here from the Facebook chat, wondering why not exclude, subject to some limit, unemployment compensation from income taxes? And to add to that, why is the state not doing withholding, so then massive tax bills are due for many?
Well, I can take a stab at that, even though, I know neither of us are on the tax committee. I certainly think that this is a problem. And if we have some money, which I think we do, I think we should definitely try to ease the burden for some folks that are, going to be facing a big unexpected tax bill here. But frankly, I'm not really understanding how all of this is exactly working, because, I think that we still tax according to income in the state. And I expect that folks, even if they're getting an extra boost on their unemployment, their incomes would probably be low enough that they're not going to have much tax burden. But I'm kind of just surmising that, since I am not on the tax committee and haven't seen this. But I certainly am happy that the state is in a little better position financially right now. And a lot of that money that is the so-called surplus is actually one-time money. So it's money that we could use to, on a one-time basis. And hopefully this issue with the unemployment insurance is a one-time issue, more or less. And hopefully we can use some of that resource to ease the burden for folks. Why they didn't figure it out with the withholding, I can't really answer that question, except that this was a federal add-on. And I just don't know the system's reason for that. But sometimes it's very hard in state government to turn these systems on a dime, so to speak. And that is really unfortunate, because I know it is much, much easier for folks to have money withheld than to be struck with a big tax bill at the end.
Yeah, I would agree. I don't know that I have a whole lot to add with that. And if there are, specific, points that folks would like to chat about more, I'm happy to, for them to send me an email and can certainly dig into it further and have some further conversation. I think just broadly speaking, again, sort of, pivoting back to, where we need to put the focus, it's on those working families who the last year has been so difficult for so many, and we need to be doing all we can to making sure that we are supporting folks who are working really, really hard to just make ends meet, and that's a lot of folks right now. So.
And just a reminder, if folks have questions, to go ahead and drop them into the chat either on Zoom or on Facebook, and we will get to those as time allows over the next 25 minutes or so. Next question, what can we do to protect the boundary waters? Also, can we speak out and stop line 3?
That's a great question. Thank you for that question. I will start. Environmental issues, climate crisis, protecting the boundary waters, these are critically important issues. I think about, quite a bit. Again, going back to, I'm a mom, I have 3 kids, and I think a lot and lose sleep over, honestly, the world that we are leaving behind for them. And so this is work that is critically important, that the clock is ticking. We need to take bold action now because time is running out. And so, there are things we can do, thankfully. And so, there is legislation moving forward around these issues. I am grateful to partner with Representative Todd Lippert on a number of conversations. And I know he is working really hard and has some legislation around soil health and around, he's really digging into this environmental work. And so happy to support him in those efforts. There are bills specific to protecting the boundary waters as well, which is critically important. In terms of line 3, this is an issue I have been fairly vocal about. I have huge concerns about that for a variety of reasons. Environmental, being certainly some of them. There's definitely concerns with that. Also have concerns about safety and health, and bringing many workers in from out of state when we are in a pandemic there are safety risks there, certainly, as far as transmission of COVID. Also, just the speed at which the work is happening there. There's already been 1 death doing this work, and so that the safety issues really concern me as well. And so I think they're just, as well as sort of the process and the not abiding by treaty rights and the speedy sort of kind of pushing this through process that this has taken. So many concerns about this. And so I have been up and made a visit to the Palisades site a couple of times just to see sort of with my own eyes what it looks like and what's happening, and appreciate the advocates who are working really hard in this space, and I'm happy to add my voice to the calls for let's take a look at this and stop this process because it's not safe.
So I would just echo what Representative Boldon said, and I'm just so grateful that we have a number of members in our caucus who are able to focus on different things. This is truly a team effort because, I'm pretty buried in health and human services, and I'm so glad that I have colleagues who are able to put much more focus on some of these other issues, and I lend my support to them whenever possible. And so I think my name's on a number of the bills that are going through here. And I've always been very strongly in support of protecting the boundary waters, and climate change is just an enormous issue. We have a climate caucus that I am nominally a member of, although I don't get to do a lot there just for time limitations, but I'm very grateful that we have this focus and, intend to support it every step of the way, because this is, as Representative Boldon said, critically important to all of our futures. And like her, I think about my kids and grandkids all the time, and I think about yours as well. And we just need to be mindful that the world is changing very rapidly, and we need to do everything we can.
Question here about hospitals. There are concerns in greater Minnesota about rural hospitals and their ability to stay viable. What's being done, or your thoughts on how to keep these hospitals viable?
Well, that is kind of a big question. There are one of the things, so I've been working in health and human services now for what, like 16 years. And every day I learn new things about how our financing system works. And it's super complicated, and kind of almost goes back to what Representative Boldon was saying before. When you have a system that is not really designed to do the things that we think it should be designed to do, and part of this is how the funding all happens. So there are different proposals out there. I don't know how much we're going to be able to do big systemic change this year, but there are proposals to have global budgeting for hospitals. Find out what do you need, and then make sure that you get that amount so that you can do all these functions. But there's a lot of this has to do with medical assistance and how the funding flows. And one of the big things happening this session is that I'm finding out some things about that flow of money that I never knew before, and it's been quite eye-opening. So I guess I just would end by saying that this is a really important issue. We need to have hospitals, and we need to have proper resources all over the state. And we need to make sure that we don't, with things like telehealth, which is, telemedicine, which is a big topic right now, that a lot of providers want to continue the big shift to telemedicine. We need to make sure that that doesn't destabilize some of our actual brick and mortar resources like hospitals where they need to be. So it's all a really complex web. And I would just say that it's very much a consideration to make sure that those hospitals stay viable.
Yeah, I would agree. I think saying that it's a complex web is a good way to put it. It absolutely is. There's a number of factors that go into this. And again, I always go back to the patients and to people, right? And what is needed for them and what makes sense for them. And it's, we need to be sure that people have access to healthcare. And so that definitely is an issue right now with closures. And so, in my work, as a nurse and in healthcare, I've definitely seen this where, and heard stories from folks across the district and across the state where, folks are having to travel long distances to see care providers. And certainly, as was mentioned, hoping that, telehealth plays a role in that. And there are certainly is a place for that, and, areas of practice where that absolutely makes sense. But of course, you can't have a baby via telehealth. And so there's absolutely also a place where, we need to be sure that people have access to care. So I think it's sort of a both and approach. And, there's many factors of this that we need to take a look at, and to be sure that people have access to that care. So I do know there is some work being done in this area, and I'm happy to support that because it is very important.
Question on the state budget here. Governor Walz has put forth a budget proposal. What are your budget priorities?
Yeah, great question. Maybe I will start with that and then hand it off. I think so. Certainly, the budget is a bulk of our work right now. That is the role of us as a legislature, and we as a state don't. We have to have a balanced budget. We don't have the ability to print money, and so we are going through this process. And the governor put out a budget, and since then we've gotten an updated forecast, which looks better, right? It puts us in a bit of a different situation as far as not looking at a deficit, but having a bit of a surplus, which is a great situation to be in, and that looks better, certainly. And it doesn't change the fact that there are still thousands of Minnesotans across the state who do not have what they need. We are not meeting the needs of all Minnesotans right now. And so we have an opportunity. We have an opportunity to do that, and to be sure that we are investing in our communities, and investing in education, and investing in early childhood care and learning, and investing in healthcare. And that's where my priorities lie, is to be sure that we are meeting the needs of Minnesotans. And how do we do that is by making sure that the very wealthiest of Minnesotans, those folks who have done just fine over the course of the last year, and in fact have done very well in many cases, that those folks, the very wealthiest, are paying their fair share. To be sure that we can meet the needs of Minnesotans across the state. And so that's, as we are working in committees about, hearing different bills and different programs and investments, that's where my priorities are, is with people and making sure that we are meeting the needs of people.
Well, very well said. And I really agree with all of that. When we look at the state budget forecast now, it shows it went from being a deficit to a surplus. But when we break it down, we see that um, a lot of that is one-time money because some of it left over from, things that happened during the pandemic, like people using less health resources because they didn't get to the doctor, right? So there are some savings in the last year's budget that are carried over. Some of it is money that came out of the reserves because of a budget agreement from last budget agreement. So this means that going forward, it's really not all that much. And it is fortunate that it's showing a small surplus going forward. But as Representative Boldon says, if we really want to make life better for Minnesotans, and especially, to make sure that our kids have what they need, our low income families, the babies get off to the best possible start, and all of those kinds of things that are so near and dear to us as Minnesotans. And not to mention protecting our environment and doing so many other important things. It really doesn't provide enough going forward. Not only that, but I always have to remind people our budget forecast does not include inflation. So it does include rising tax revenues. So yes, it tells us that there's going to be more money, but it doesn't include the fact that things cost more year over year. And so it really is not a very good representation of what we have. So I totally agree with Representative Boldon. We need to keep trying to rebalance our tax system so that people who really are doing very well, great, good for them, but they can easily afford to put more money into Minnesota so that we can pull everybody up, because really at the end of the day, we really all do better when we all do better. Black, brown, white, whatever color you are, whatever age you are, whatever circumstance you're born into, wherever you were born, we need to make sure that we all do better. And that is how we will get ahead as a state, and not in any other way.
Next one here was phrased as a statement, not a question, but I think you can address it just the same. Health support should be handled by nonprofits, not by for-profit insurance. That would be a great bill.
I actually have that bill filed. But it's not going to go anywhere because this ship unfortunately has kind of sailed right now. And but I totally agree. Unfortunately, I would also add to that, sometimes our nonprofits don't really act like nonprofits. So the edges are really kind of blurred here. And kind of one of the big works of my whole career in the legislature has been to try to untangle our public programs from how they're currently handled and how they flow through health insurance companies right now. And if nonprofits would just act like nonprofits, it probably would be a lot easier to keep that separation. But believe me, we are watching this, and yeah. Thank you for that comment.
I would just say again, it goes back to that. It's a really tangled and complicated web, and I think that's certainly a discussion to have, and one that we need to have. As the goal is to be sure that people have access to quality care when they need it, and so I think having that conversation of what is the best way to go about that and how do we do that is one that we need to have.
Question here on education. How do we ensure that we have fully funded, equitable education available for every child in every community in Minnesota? Is an increase in funding for our schools in the budget proposal? And if so, do you support it?
Yeah, great question. I think this sort of goes back to the question about the budget, right? And so I would say that, how do we do that is it's an investment, right? And probably one of the most important investments we can make, investment in our kids is an investment in our future. And so, yes, we absolutely need to be increasing the investments in our education system to be sure that we are fully funding education, to be sure that kids and schools and teachers have what they need, have the resources they need. As we are looking at, as we have seen over the course of this last year, schools are not just a brick and mortar building where kids go for 6 hours in a day to learn facts. Like, schools are at the core of communities oftentimes. And as we are seeing more community schools with wraparound services, schools over the last year were, helping to feed children when, there were resources for that weren't available elsewhere. And so we absolutely need to invest in our schools and in our kids and in our education system. That is an investment in our future and should be a priority as we move forward. And again, I would go back to, how do we do that? It's that we all need to pay our fair share, and the wealthiest of Minnesotans need to pay their fair share to be sure that we can do those things that we need to do for our future.
Well, absolutely. And this year of all years, I think that everybody knows that COVID and doing school remotely has been extremely hard on children. And we're going to see gaps, and there's just no question that we're going to need extra resources to try to help our kids get back on track. And I think, now I don't serve on education, but I think that the governor's proposal involves summer school resources. And it's certainly going to take extra resources. I think our schools are kind of chronically underfunded, even on a good day. And now we have these really extra challenges. So I think there's going to be, I just knowing my colleagues, not knowing any of the specifics, but they are going to be pushing for increases in education. And I'm going to be right behind them supporting that, because we got to focus on our kids. And as Representative Boldon says, this is not just about what facts you know. This is about the child's well-being and frankly, the family's well-being as well. So I think this is just super important. And often that's where Democrats in the legislature try to put a lot of the resources. And I think this year will be absolutely that way, probably a lot more so. And that is one of the big reasons that we're still going to try to need to raise additional resources, because we can't leave our kids behind.
Question here on driver's licenses for all legislation. Our immigrant communities have been at risk during the last 4 years. They need legal driver's licenses and support. How can we move that forward?
This bill was just heard in the Judiciary Committee, which I do sit on, and the Democrats all voted for it. I think every Republican voted against it. This is just kind of what's happened every darn time. I don't, this just seems like a no-brainer to me. A driver's license is just an absolute thing that everybody needs to live. And I'm so glad to see the Biden administration trying to move forward with some real reform to our immigration and stop treating people like they're not people. They are our neighbors. They need the darn driver's license. Republicans should understand this as well as Democrats. Some of them, I think, have in the past understood this. I don't know why they're voting in lockstep against it right now, but unfortunately, that's what's happening.
I would agree. This is a no-brainer to me as well, something that should absolutely happen. It's a matter of dignity. It's a matter of safety. It's absolutely an issue that we should all be able to get behind. If and when it comes before me, I will happily support it and vote for it. I am hopeful that perhaps there can and will be some movement on the other side of the aisle with this. I know in candidate forums last fall, Senator Senjum verbally said that he would support it. So I'm hopeful that that remains true and that there is some movement on the other side of the aisle, because it's something that we should absolutely do.
Constituent here wondering if you can speak to the current status of vaccine distribution and how we can improve upon it.
Great question. Oh, go ahead.
So yes, oh boy, this is just such a huge question. Absolutely. I just want to start by saying that there was no blueprint for how to do this. Just like any of the pandemic, this has been kind of something that people have had to use their best efforts and information to try to construct the plane in flight, as they say. And really, the Walz administration has done pretty darn well, I would say, on this, while recognizing that there are some frustrations and there have been some missteps and difficulties. And I would just say that I think that's kind of inevitable in this huge, big, complex situation. So now with the Biden administration, that we have seen a much bigger flow of vaccines, I think that some of these real, genuine concerns and anxieties that people have had will pretty quickly fade into the background, because we're going to right now, and we're already right now seeing a big ramping up of availability. And they have been working nonstop to try to improve and figure out. And I know there have been big concerns about people with disabilities and chronic conditions who don't live in congregate settings, don't live in group homes and so on. So they've been, they feel very sometimes abandoned. But there is now the vaccine connector, and I don't know if we have that information right here and now, but maybe, I don't know if DJ has it handy, could put it in the chat, but everyone should be sure to sign up with the vaccine connector so that you will be notified at the first availability for you, because it collects some information that will allow the health department to, to actually reach out to people when they could be eligible, because it's been very difficult to, there's no database anywhere that says, who has a disabling condition, or, who works in a certain place where they're exposed more frequently. And yet all these things are very, very important. We with the limited supply of vaccines, we want to first get them out to people who are at the most risk, both for catching COVID, but also for getting really sick and dying from COVID. So they've tried to do that. We know it isn't perfect. We understand it's so frustrating for folks, but I'm really hopeful that pretty soon it's going to be so widely available that the question is going to be, how do we get more people to sign up? And I hope that when that point comes, that tipping point comes, and I think it's going to come pretty soon here, that we can all join together to encourage people to actually get the shot. But I hope that helps address it. And please, with specific questions, please do feel free to email me.
Yeah, agreed. I agree with all that, and would just add, so it looks like we do have the link for the vaccine connector in the chat there, and would encourage everybody to go on and fill that out if you've not yet had your vaccine. And just to reiterate that, the vaccine is our path to the other side of this. So would encourage everybody to get your vaccine when it becomes available to you. And know that COVID, it feels like we are in a better place. We are in a better place. Numbers are going down, cases are going down, but we are not out of the woods. And so just a reminder that we need to continue to do all of those things that we have been doing to keep each other safe, wearing the masks, keeping the distance, not gathering in large groups. All of those are still critically important, because we are not out of the woods with this yet. And so we are seeing the rise of variants and these things. And so it's sort of a both and of following the recommendations as well as getting vaccines. And I am really hopeful that we are, making headway with vaccines. We are seeing the numbers, the supply is increasing with that. We learned this last week that Minnesota is number 3 in the nation as far as vaccine distribution, which is great. We also got a bit of information this week that we have opportunities with more equitable distribution of vaccines, which it does not come as a surprise probably to most people, as we are, using our healthcare system, and our healthcare system has racial inequities baked within it. And so we absolutely need to take steps to be sure that we are getting to a more equitable distribution of vaccines. And I trust that there are efforts happening to do that. And so just something we need to keep on the radar.
Okay, we're about out of time here, so this will be the last question. I'm an activist, says the constituent, for leaving nature alone. Constituent notes that there are native sumac trees in fields. Wondering, are there laws to keep native trees in open fields in Rochester protected from being destroyed?
Well, that's a great question, and thank you for bringing that question. And I will be honest to say that I am not. I don't know that I know the answer to that question. I am happy to dig into it a little further. I am not aware of any specific legislation specific to that exact issue, but certainly appreciate the perspective and the question. And just going back to that sort of more broad environmental issues is certainly of importance to me, and want to be sure that we are protecting our environment.
Great. And, I don't know the answer to that question either, but this is a great opportunity to invite you all, if you have a specific question like that, to email us, because we can find out. And oftentimes people don't even know who to ask about certain questions. It may be that this is a local Rochester ordinance issue. It may be that it's a state issue. I just don't really know, but, happy to have you ask. And if we can't find out the precise answer, we can at least find out who will know the precise answer. So really appreciate this. And the whole issue about native flora and fauna and all that is of great interest to me. And I wish we had like an hour to talk about all of that, but we don't. But thank you for the question.
All right, so do each of you want to just offer some brief closing comments and let folks know how they can stay in touch with you?
Sure. Representative Liebling, do you want to go first?
Sure. Either way is fine. So I kind of just did make my little closing pitch there, but all of our email addresses are on the same pattern. So it's REP for representative, REP dot, and our first name dot, our last name, at house.mn. So emailing is really the best way. I know sometimes people try to reach me on social media. I am very spotty in even looking at social media, especially during sessions. So please do email me, and then I can get an answer to your question if I don't know it. And I really do try to keep up on my email, although not always successfully, but really appreciate hearing from people at home. And thank you so much for your interest in joining us today. It's great to have you with us.
I agree. I would echo that. I just really appreciate you, sharing part of your Saturday morning on what looks to be a beautiful day with us, and really just appreciate the dialogue and the questions. And again, I will just say it's really important to me to make connections with folks, across the district. And so please do reach out via email if you have questions that didn't get answered, if you would like to know more about different issues or chat about other issues. Happy to make connections and look forward to doing this again. This is great. And I think we plan to continue to do these. And I am grateful to partner with Representative Liebling, and thank you all for your time.